Welcome to the Aced It podcast, where we turn science into sense. This is season 10, and in this season, we will provide 10 knowledge-packed episodes with the hopes of helping listeners understand what we can all learn from current research on overdose. It's a hard topic to discuss, but critically important information to know. So I am honored that you're with us. I'm Danielle Rudes, your host, and this is Aced It. Welcome to today's episode, where we delve deeper into important topics shaping public health by further exploring a critical issue: opioid overdose risk factors. Opioid overdoses have become a significant public health concern globally, affecting individuals and communities alike. In this episode, we'll unpack the findings from 2 key studies on this topic and discuss what you need to know about the factors contributing to overdose risk from opioids. Stay with me as we navigate through this important conversation. Let's start with a reminder on what opioid overdose entails. Opioids are a class of drugs commonly used for pain relief, including prescription painkillers like oxycodone and hydrocodone, as well as illicit substances like heroin. These drugs act on the opioid receptors in the brain and can depress the central nervous system, leading to effects like pain relief and euphoria. However, opioids also carry significant risks, particularly when used inappropriately or in high doses. An opioid overdose occurs when the body is overwhelmed by the drug's effects, leading to respiratory depression, coma, and potentially death if not intervened upon properly. Now let's dive into one study by researchers Lepato and Terplins that examined several factors that contribute to the risk of opioid overdose. Certain demographic and behavioral factors significantly increase risk of opioid overdose. For instance, younger adults and males are more prone to opioid overdose. Additionally, individuals with a history of substance use disorder or mental health conditions face heightened risks. This is because these conditions can increase vulnerability to the effects of opioids, leading to increased likelihood of overdose. Beyond individual characteristics, social and environmental factors play a crucial role as well. Social isolation, lack of strong social support networks, and living in environments where opioids are readily available. This can be both legally and illicitly. All of these factors contribute to higher overdose risks. The study I mentioned underscores how these factors create environments where individuals may face increased exposure to opioids without adequate support systems in place. For example, the authors highlight that individuals living in environments characterized by socioeconomic disadvantages, high rates of unemployment, and limited access to healthcare are more likely to encounter situations where opioid use becomes a coping mechanism or a means of self-medication. These environments often lack sufficient resources for substance use disorder treatment, mental health support, and harm reduction services like naloxone distribution. The authors discuss individual-level risk factors and risk factors related to post-incarceration and post-treatment. For example, they outline how post-incarceration and post-treatment outcomes play a crucial role in opioid overdose risk. Individuals leaving incarceration or completing substance use disorder treatment programs are at increased risk due to factors such as reduced tolerance to opioids and challenges in accessing continued care and support. Stay with me here. This is important, as I'm telling you that individuals leaving prison, jail, or leaving treatment for opioid use disorder are at an increased risk for overdose. Transition periods following incarceration or treatment require targeted interventions to reduce the risk of relapse and overdose. This highlights the crucial and potentially life-saving importance of comprehensive reentry and aftercare programs. Broader policy and structural factors also play a role in shaping opioid overdose risk. Socioeconomic disparities, unemployment, and homelessness are structural issues that contribute to higher rates of opioid use and overdose in affected populations. The presence of some or all of these factors highlight how social conditions affect health and substance use, stressing the need for thorough public health strategies to tackle these problems. The researchers elaborate on how limited access to healthcare services is another significant factor. This includes barriers to treatment for substance use disorders, inadequate access to mental health services, and lack of access to overdose prevention measures such as naloxone. Naloxone is an opioid antagonist, effective in swiftly reversing the effects of an opioid overdose by blocking opioid receptors in the brain. Its timely administration is crucial in emergency situations involving opioids, playing a vital role in saving lives. Research indicates that increasing access to naloxone can significantly reduce opioid-related mortality rates. However, challenges such as distribution logistics, training requirements for administration, and legal barriers to access can limit its widespread adoption. Efforts to expand naloxone availability and education campaigns on its use are essential to maximizing its impact in saving lives during overdose emergencies. In a related study, Webster identifies several factors that increase the risk of developing opioid use disorder, or OUD. Much like many other addictions, say alcoholism, for example, genetic predisposition plays a role in how individuals respond to opioids. A family history of substance use disorders, including OUD, can heighten susceptibility to opioid addiction. Younger adults and adolescents are particularly vulnerable to opioid misuse. Similar to the previous study we discussed, this study also discusses how factors such as early exposure to opioids for pain management can increase the likelihood of developing long-term dependence. Socioeconomic status and ethnic background also influence opioid use patterns. Lower socioeconomic groups may face barriers to healthcare access, increasing their risk of opioid misuse. Beyond addiction, opioid overdose remains a critical concern. Factors contributing to overdose risk include higher doses of opioids prescribed for pain management, which can increase the risk of overdose, especially when combined with other medications like benzodiazepines or alcohol. Easy access to prescription opioids and illicit substances in certain communities contributes to higher rates of overdose deaths. Co-occurring mental health disorders such as depression and anxiety amplify the risk of opioid overdose. These conditions often exacerbate vulnerability to substance misuse and can lead to intentional overdose. In fact, one of the most alarming aspects discussed in Webster's study is the relationship between opioid use and suicide risk. Individuals with OUD are at increased risk of suicidal thoughts and behaviors. Imagine being constantly in pain and how much that could impact you psychologically, mentally, physically. It would take a significant toll on your work, your exercise, your day-to-day functions, and even just your desire to see friends and family. It's no surprise then that chronic pain and opioid dependence can lead to feelings of hopelessness, contributing to suicidal ideation. Psychiatric issues like depression that often accompany opioid use are linked to higher risk of suicidal thoughts. So you can see how managing mental health well during opioid treatment is crucial for lowering the risk. In some cases, opioid overdose can be associated with suicidal intent. Individuals experiencing overwhelming emotional distress may intentionally misuse opioids as a means of self-harm. Addressing the opioid crisis requires a multifaceted approach. Healthcare providers should conduct comprehensive assessments for opioid use disorder and suicidal risk factors. Tailored treatment plans, integrating pain management and addiction recovery are essential. Distribution of naloxone is critical to saving lives during emergencies. Public education on naloxone use and overdose prevention is also vital. So how do we help? Well, we can begin by advocating for policies that promote responsible opioid prescribing practices, improve access to addiction treatment, and support mental health services. This is all crucial for reducing opioid-related harms. As we conclude, it is clear that addressing the opioid crisis requires a comprehensive approach. This includes public awareness and education to increase misunderstanding of the risk associated with opioid use and overdose, policy interventions to promote responsible opioid prescribing practices and improve access to treatment for substance use disorders, and community support to reduce social isolation and provide resources for individuals at risk of opioid misuse. By understanding the complex interplay of individual, social, environmental, and structural factors contributing to opioid overdose risk, we can work toward thorough solutions that prioritize prevention, intervention, and harm reduction. Thank you for joining us on this episode. We hope this discussion has provided valuable insights into the factors contributing to opioid overdose risk and the importance of interventions like naloxone in saving lives. Remember, awareness and action are key in tackling the opioid crisis and supporting affected individuals and communities. Stay informed, stay safe, and until next time, take care. Wait. Hold on. One more thing. If you want to start helping right now, you absolutely can. You can add Narcan to your first aid kit by picking up a bottle of Narcan nasal spray at many retailers like Walmart, Target, Walgreens, Amazon, and CVS. You can visit www.narcan.com to learn more about what overdose signals to look for and how to dispense Narcan safely. On that website, again, it's www.narcan.com. You will also find several informative videos regarding Narcan, its use, and what to do in an overdose situation. It may seem like a small part for you to play, but even one life saved is worth it. Thank you for listening to the Aced It podcast. We love hearing from you, so if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me, Danielle Rudes, at Sam Houston State University. My email is drudes@shsu.edu. And as always, thank you to the Justice Community Opioid Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters, Dr. Chelsea Narvi from Sam Houston State University and SHSU master student Jalen Magana. And a huge and a heartfelt thank you to Jason Luchin and the team at Slonky LLC for their wonderful production, as always. Tune in again soon for another episode of Aced It.